My name is Ajit Sachdeva, and I'm the Director of the Division of Education at the American College of Surgeons. I'd like to warmly welcome you to this professional development webinar series session this evening that is being conducted under the aegis of our wonderful Committee on Medical Student Education. And this whole series has been designed to help medical students in selecting their careers and in preparing to enter residency training. This evening, the experts are going to be talking about the pros and cons of away rotations during the fourth year of medical school, a very important topic and one that has been a subject of a lot of discussion and debate over the years. The session will be moderated by Dr. Stephen Yang, who is the chair of the Committee on Medical Student Education. He is an endowed professor and the head of the Division of Thoracic Surgery and a professor of oncology at the Johns Hopkins University. He also plays a leadership role in faculty development within the Department of Surgery, and he is a member of the ACS Academy of Master Surgeon Educators that recognizes his eminence and preeminent role as a Master Surgeon Educator. I would like to thank the two expert panelists who will be introduced by Dr. Yang. And before he introduces the speakers, I would like to thank our wonderful staff, Dr. Patrice Blair, Ms. Kim Eckert, Ms. Cassie Bucagnani, and we are very fortunate to have the technical support of Ms. Alita Harris from our Convention and Meetings Division, who's helping us with the technical elements of this webinar. So thank you for joining us this evening. I'm sure you'll have a wonderful time, and we look forward to your feedback and good luck in your professional careers. So with that, I will turn the floor over to Dr. Yang. Thank you.
Well, great. Thank you, Dr. Sachdeva, for your very kind introduction. And we always have appreciated your support and also Dr. Blair's support for all of our medical student activities. So good evening, everybody. My name is Steve Yang. I'm a thoracic surgeon at Johns Hopkins, as Dr. Sachdeva mentioned. I've been intimately involved with medical student education for, I guess, almost 20 years now, and I'm very honored and proud to lead this Committee on Medical Student Education. We've had a number of webinars over the last 2 years, which were initiated during the pandemic since we couldn't meet. And I suggest you to go to the ACS website and look at these. We have a plethora of medical student support resources, these webinars, as well as other curricula that may be useful for you in your career. So I'm gonna start sharing my screen here. As we mentioned, this is a very difficult topic, whether you should stay at your own institution or should you go do some sub-Is. And so that will be our topic this evening. We chose this title. Some of you may be not old enough to remember The Clash. They had a very popular song in the 1990s, so Should I Stay, Should I Go? So I encourage you to listen to that song. Some of the lyrics actually are quite applicable to many things that you think about these days, not only with sub-internships, but, should you stay there for your residency? Should you, later in life, should you move on? So to some of us older folks, we feel that this is a very poignant song. This time is a very difficult career part where you're trying to decide, what subspecialty you may be going into in the surgery. Do you want to look at other places? Are there some family issues that you have to consider in your future? And so we're hoping that with our expert panel tonight, it's going to help you make some decisions. Now, there are some factors, and I think Dr. Schnartz and Dr. Lippman are going to go through this, but some things that you have to consider are the costs of doing it. Obviously, it's much more difficult now with the higher cost of gas. And since board scores are either pass fail now, and some of the letters are fairly generic, do you want to be a spotlight at that program? Do you want to shine, and where do you put all of your efforts? What time of year do you want to do it? Obviously, when all the medical students are trying to do sub-Is at the same time, there's a lot of crowding factors there, and so should you try to do it later on when there are not as many fourth-year students? Where should you go? Do you want to go to the best programs? Is there some location? Do you want to be closer to family? Are there other programs that will help you with your research? So again, that's a difficult decision. And then, finally, this may be the only way of getting yourself into the door. This day and age of virtual interviews, you may not really be able to stand out amongst your colleagues. And so, should you go to a program so that it does stand you out a little bit. So this evening, very briefly, the agenda that we're going to go through is to review some of these issues in selecting surgical rotations away from your home institution, noting that some of the benefits will vary depending upon the subspecialty and the individual location. So we can't be too prescriptive, as there is some heterogeneity out there. And then finally, we'll sort of discuss some of the drawbacks of these rotations. Now I'm going to start as a subspecialty. What we did is we queried our 10 advisory subspecialty councils just to see, what they thought about these sub-Is and rotations away, and to look at the importance of away rotations for these subspecialties. And what I did is I listed them according from those subspecialties who thought they were optional to those subspecialties which they felt were essential. And so neurosurgery was at the top and felt that this was essential in order to ascertain a good residency program. Whereas orthopedics, again, was not as strong, and they thought that it was fairly optional to do this, and all of the other subspecialties are sort of smattered in there upon their strength of advice and whether you should go away. And the other question that we pose them is that does doing a sub-I at their institution influence their match results? And so with neurosurgery, plastics, cardiothoracic, vascular, otolaryngology, and OMF, it definitely did. And so if you did spend time there, it did positively influence your ability to get a good match. And then some other subspecialties were sort of lukewarm as far as whether it helped you. It mainly helped you in getting an interview, but not necessarily push you up on the rank list for OBGYN, urology, ophthalmology, and orthopedics. And so, what we're going to do now is do a very quick pro-con debate. And I encourage you to stay on for the entirety of this. And at the very end, we will be asking you to do a survey. Those of you who want to ask questions, we really encourage you to use the Q&A icon to ask questions. We will try to do our best either to answer them live or do them in the chat box. So here we go. These two guys have been waiting for this. They've been dying to debate each other since we've thought of this idea. And so I'm thinking about, what are some of the great battles in history? There's the old Game of Thrones, when the White Walkers battled Jon Snow. And then dear to my heart are the Ravens versus the Pittsburgh Steelers. And even closer to my heart is the Duke-UNC rivalry. And so these two guys have been on the committee for years, and they hotly debate each other. So let's get ready to rumble. Tonight, ladies and gentlemen, we have an awesome battle between two educational heavyweights. Some call it the Creighton versus Cleveland. Others call it the dean versus the DIO. I name it the kernel of trauma versus the colorectal commander. And without further ado, here's the main lineup. In the pro corner, weighing at a full professor of surgery at Creighton, which includes all his combat valor medals in Afghanistan and Iraq, the dean at Des Moines, our vice chair of NICE, the colonel of trauma, Paul, I don't wear no PJs, Schnartz. And representing the con corner, also weighing at a full professor of surgery at Case Western, the DIO that everyone woes at Cleveland Clinic, the colorectal commander, Jeremy, I don't take no lip man. Now, gentlemen, I want to debate like we've been seeing in government these days. A lot of low blows, many dirty insults. I'm firm and I'm biased. You'll each have 10 minutes to state your case, 3 minutes to relick your wounds, and then you'll be subjected to our audience abuse at the end. Dr. Lippman.
Well, thank you for that introduction. Appreciate it very much. I am from Pittsburgh, in addition to now living in Cleveland, so the Pittsburgh-Baltimore thing is near and dear to me as well. We'll talk more later. Well, I'm honored to be here, and I have no disclosures relevant to this discussion. And I want to start by just acknowledging my opponent, Dr. Schnartz, who I have to say I have nothing but the utmost respect for. He is a veteran, a combat veteran. He has a wonderful family, and more than anything, I respect him as an educator and leader. He is a thought creator in surgical education, and he's someone that I have aspired to be like for much of my career. Having said that, when he wrote this book, the book of being wrong, I think it was this topic that he had in mind. And so as we're talking about doing away rotations, and should you leave home and go somewhere else to do part of your medical school training, I hope to show you in the next few minutes why doing that is a mistake and why you're better off staying where you are. And it comes down to really three things. One is your education. And you're paying an awful lot of money in most cases and have invested an awful lot of time. That should really be number one priority. Second, you've built a community where you are. And I'm going to talk about how doing the away rotations can negatively impact that community that you've built. And third, money. We do have to come back to the bottom line across all of these things. So let's start by talking about your education. Your 4 years, 5 years at some places, medical school is a curriculum that's built one piece on top of the other. The first year lays down the foundation. The second reinforces and builds on that. You do your clinical years. And the fourth year is arguably the most important year for you to put the finishing touches on all that you've learned, pulling it all together, actually getting to apply everything that you've learned into an experience where you are functioning as the doctor for many of your patients. And that is at your home institution. That's how it's designed to work. They know what you've learned. They know what you're building on, and they know the knowledge gaps that are expected to be filled with acting internships and sub-internships in your final clinical year. You have all these bricks of knowledge and experience and wisdom that it's finally time to put together into your mansion of knowledge and your mansion of experience. And the people that you're working with at your home institution understand that, and they're able to help you to line up those bricks and put them in just the right place. You've also built the trust of the staff. You've done your core clerkships. You've been around, you've become a known entity. They're much more likely to hand the scalpel to someone that they know and that they recognize than being at another institution where you're an unknown person with unknown skills. It takes a lot longer to prove yourself in those new environments. There's also all of the extraneous stuff that you have to learn when you go to another place. The electronic health record may not be the one that you're used to. There's so many different versions, and trying to pick that up in a very short away elective is a huge challenge that's going to take away from your ability to shine under that spotlight that Dr. Yang showed us. Plus, getting around. I hesitated to show a photograph of what my institution. I work at Cleveland Clinic. Our institution literally has its own zip code. It's that big, and finding your way around is not easy. I'm still figuring it out. This is not from our place. This is from somewhere else. But figuring out all those places to go, how to get somewhere, all these efficiencies that you've already mastered at your home place just become burdens and barriers to demonstrating your ability when you go somewhere else. Plus, you have to learn the culture. You know, if you're a polite individual who likes to eat their soup with a spoon versus someone more like Dr. Schnartz shown in the lower picture, who likes to just sort of pour it in there, you may stand out, and that may hurt you. What works in Nebraska may not work in Baltimore. So those things can negatively impact the impression that the programs have of you as you're spending time there, even though you're an excellent student with a lot of knowledge and skill to demonstrate. All of these things just become extra water in the glass, overflowing, making it hard for you to both perform and to learn. Because remember, at the root of it, these acting internships, sub-internships, whatever you want to call them, are designed for you to put the finishing touches on the learning that you've done in the years preceding. This is not to mention the community that you've built at home. All the staff that you've worked with, the residents, everyone wants you to succeed. Having someone from your medical school, from the home medical school of the institution, go on to a great residency, everybody wins. Everybody celebrates that. They want to help you. And so when it comes time for that golden letter, that incredible letter of recommendation to come forward, or that phone call that someone has to make to the chair or the program director at the institution you really want to go to, you want to have built a really solid community of support around your application. And you do that at your home institution with lots of rotations and exposure to different staff and different residents. So everybody is there to back you up and help you to make that next step. Because when you succeed, they succeed. Your great match is a win for everybody there. Now, the last thing that I'll bring up is something Dr. Yang touched on, which is the expense of travel to these other places. And it starts with the VSAS or VSLO, as they're now calling it, the fees that are charged there for you to apply to different programs. This is I literally just put in Expedia a flight from Boston to Cleveland, coach. We don't fly like they do in Nebraska. It's all coach. I mean, it's $1,000 right now for me to fly directly from Cleveland to Boston. That's a nice piece of money. Gas prices are not helping you if you decide you're just going to drive. I don't know if you've been on the news. It's not looking too good right now. Not to mention your lodging, if you rent a car. Plus, you've got the apartment that you're already paying rent on that's going to just sit there empty. Not to mention all of your loved ones back home that you're unable to be with. And I know Dr. Schnartz's cold, dark heart doesn't care about that. But it matters to me, and it matters to your family and your loved ones. As you can see in this recent picture taken of Dr. Schnartz and completely unedited, he doesn't care about money. He doesn't care. He's got plenty to burn. But these things really should be important to you, and I understand where you're coming from. And so I think that you can understand that thinking about your education, the support of the teams that you've built around yourself, and the finances all indicate that you should stay home for these critical electives in your last year. And with that, I will yield the floor to Dr. Schnartz for his rebuttal.
Oh, Jeremy. Wrong. But before I start, I do need to acknowledge Jeremy, not for the good man that I know he is, but I do need to tell a brief story, and that is my wife and I went on a date this weekend, and she asked me what I was doing this week, and I said I was going to debate Jeremy, and she spent the rest of the evening talking about Jeremy. That's why I don't have any pictures of him, is because my wife has them and they're socked away, I think, in our family Bible. But I do have great respect for Jeremy, and I will admit to all of you here, I'm 0-1 against Jeremy. He smoked me a couple of years ago, and I've never forgiven him. But I think a little bit different, and I didn't want to use my opponent's youth against him. So I decided not to use slides. I decided just to sort of talk, because I imagine most of you medical students are tired of looking at slides, and I don't know. So let me try to hit upon some of the stuff that poor Jeremy just was misinformed about. The first is, this is about you. This is your career. And while I do agree that you have a landscape and that people know you there, and being surrounded by friends and family is important, because Jeremy seems to like to surround himself with my family. A couple of things I would say is, one is, I think the landscape is changing. We're seeing a rapid rise in the number of applicants to residencies, and to get yourself noticed, I think, is much harder. And I think we live in a wider world than Cleveland or Pittsburgh, and that, we have osteopathic graduates, we have international graduates, and some of those folks just don't have the opportunity, to see the big places. And I think that that's important. And I think for certain select people, you may want to stay at home, but I think for a lot of others, if you don't have those opportunities at your school, then you definitely should look someplace else. The next is, again, I'm going to fall to this, is all about you. And it's important, as you explore things, to fully explore all residencies. And one of the challenges is that medical students get on a train. They're just on a train. And, and I got to do good in USMLE, and I have to stay good on step 2, and I've got to do this, and I've got to do that. But you're all within the same university. And I think it's reasonable to go take a look around, go have an adventure. If you've not been in the Northwest, go to the Northwest. If you've not been to the Southeast, go to the Southeast. See something different, learn different ways of thinking. It will make you, I think, a more well-rounded person in general, and a surgeon in particular. I think the other thing that's important is that while many of the residencies are in universities, the truth of the matter is many of them are non-university programs that are just as academic and just as strong as some of the universities. And I think if you've not seen one of those, it's good to go check that out. Now, I'm under no illusion. I will say a couple of things that I would agree with Jeremy on. One, family is important. I was amazed he could get his teddy bear looking so sad there. But I do think it's important to see what it's like to live in particular places. And, with the Zoom world the way it is, and interviews all by Zoom, I think you don't get a feel for, do you really want to live in Atlanta, or do you really want to live in Tacoma, Washington, or wherever? I think it's, you don't want to end up in a place and find out you don't like living there. The other thing I would say that is important is to see how things are done differently. Not everybody does things the way they're done at your institution. And so you'll have a little broader application. You can talk a little bit wiser. I would agree, I would not get a letter of recommendation from an away person. And I do agree that, you are at a little bit of a disadvantage with different electronic medical records, and there always is a risk of getting lost. But I really think, you're doctors. I think the chances of you not being able to find the refreshment area is overstated by my worthy opponent. And lastly, I want to just say, I think everything Jeremy said was mostly fake news, but I think we have an awful lot that we actually do agree on, particularly that I have a nice wife that seems that Jeremy really likes, and she likes him too.
Jeremy has 3 minutes for a rebuttal.
So I think Dr. Schnartz has made some good points, and I think it is valuable, one, for seeing different styles of institution, for understanding what's out there. There is some value in exploring what other types of systems are available. And as you're thinking about your residency decisions, you only know what you can see right in front of you. So doing an away rotation for that type of purpose could add some value. However, I would encourage that if you have different opportunities, most of the medical schools have different opportunities for rotations at different sites within the same medical school. That is the better use of your time. That if you can get to a VA or a county hospital or a university hospital within the same system, that you'll get those same type of exposure, again, while enhancing and building the community of support that's around you. One thing that came up that I saw in the chat, and I'll look to Dr. Schnartz to answer, since he's heavily involved with the DO school, is whether that makes any difference. I think that across the board, if you have these opportunities at home, you're much better off taking advantage of them at home. But if you don't, if you're at an institution where you're very limited, or I know that some medical schools don't offer any clinical rotations at home, that you're going to other places for everything, well, that's a different story. But I think that if you have these opportunities as part of your institution, that you're, for the reasons that I outlined, going to be much better off sticking closer to home. Dr. Schnartz.
Well, I'm glad you finally see things my way. No, seriously, I actually agree with that. Many medical schools do have different experiences that you can partake in, and that is a useful thing to do. But you probably have already done that, and so I think that the opportunity to see something completely different set of residents is important. My second comeback point, and this worries me the most, is that we have this application fever now, and we're getting massive numbers of applications, and I think it's going to be really hard to stand out unless you have some way to connect. Now, I will say that in a bigger institution, if you go to Cleveland Clinic and you go to the trauma service, but Jeremy is the program director, he might not know you're alive. And so I think you have to make sure that you get on a service that where the program director is, or somebody who's a mover or shaker. And with respect to the international students and the osteopathic students, a word of caution and encouragement. One is I think, seeing how a residency runs, seeing the challenges there are very, very important. Showing what you can do will be important so you don't get screened out. I will say, though, this is not a panacea. So I will have to agree with my friend Lippman here, in that, there are no guarantees. We have a number of times where students do an away rotation, they don't even get an interview. So so in some ways it's helpful, in some ways it's not. But I think overall, it's about your career, and if you want to go check something out and see what it's like to live in that environment, I think it's worth the cost. I think of it more as an investment. And somebody's asking in the chat, if I could, general surgery. I think right now we're talking mostly about general surgery, but to answer Brianna Taylor's question, that I doing your away rotation and thinking about fellowships is putting the cart way ahead of the horse. You got to get into the residency first, and so it does not improve your chances. I don't believe in that. So I'll turn this over to the referee for the final count. Did I win?
Well, I think we'll staying on that point as well. I think there's quite a few questions surrounding general surgery. Are these points valid for that? Plus, getting exposure to other subspecialties. So say your hospital doesn't have orthopedics or cardiothoracic. I mean, should you go away to other places to do, should you do general surgery in the hope of getting a fellowship at that program, or should you just do a subspecialty sub-I?
I think if people are talking about wanting to do a primary match subspecialty like ENT, orthopedics, plastics, as was asked in the chat, if you don't have that available at your institution, then that's a different story. You want to have mentors and advisors that are going to be invested in you and have worked with you. Those letters are going to be very important. If we're talking just about general surgery, though, certainly all the medical schools will have a general surgery sub-internship available. And there is where I would say that you're going to have a larger benefit from being with the people that you know and that are associated with your school.
I would actually agree with Jeremy, I think, on that to some extent, that you should not be under any illusions that going to an away place, the heavens are going to open up and it's going to be like, a student from this school has shown up. You're going to have to really perform, and you have to bring on your A game and how to stand out. And as far as, I would consider all of your fourth year rotations to be, in essence, acting internships. And I think how do you stand out when you go is really about, how well do you work with the team? What is your knowledge base? And in some ways, and I didn't want to give Jeremy an in here, but I think in some ways an away rotation, it can hurt you more than it can help you. In that if you do not perform well, then the devil they know is going to be worse than the devil they don't. And so if you go, you have to go fully prepared, fully ready to do a great job. And I've advised students, if you're going to go do, ICU at Cleveland Clinic, well, hopefully you've done a, trauma acute care surgery rotation back at your own place so that you can stand out and look good. What do you think, Jeremy?
Yeah, I think that's an important point. And someone in the chat also asked, if you have somewhere that you really want to be, is that somewhere that you should go and try to make yourself a known entity? It is a double-edged sword. So on the one hand, when we do our review of applicants, and Dr. Schnartz and I are both former program directors in general surgery residencies, you have the group of students that we've worked with that we really know and understand and come to get a very complete picture of. And then you have everybody else who is, a series of short interviews in their application. And in some cases that really helps them, and in some cases it hurts them. So if you are an outstanding clinical student and everyone tells you, you're just the best thing since sliced bread on the wards, and there's a place that you really, really want to go, your partner is at this institution, your family's there, your favorite botanist that your plant needs to go to, is right in this city, then that is probably a reason to go to that place, demonstrate yourself, and try to get an inroad. But short of that, that's all you're going to really accomplish there, is becoming a known entity at that program. And you're using up the very limited time that you have between when you finish your core clerkship year and when the ARAS application is open. And my strong opinion is that you want that time to be spent with people who are going to write you great letters, who are going to support you and help you through the whole process that goes from end of September until match day.
So Jeremy, can I ask you a question? How often have you had an away student bump up on your rank list?
That's a good question. Not very often. Students who come and do an away rotation with us, we make it a point that they will have a meeting with the program director. We try to get time with them. We talk to the people that have worked with them. But honestly, at the end of the day, it's a short exposure, and it has not been that influential on the rank list overall. It has, on occasion, completely tanked an application because someone gives the wrong impression, has a bad interaction with somebody, and that's it. And there's not a lot of time to recover. Whereas for our home students, we may have someone who had a bad interaction in July, but then everyone else who worked with them had great interactions, and they're sort of salvaged from that problem.
So I, Jeremy, I've had the same experience, and that I can only think of one applicant ever who we bumped up, and we bumped him up from like 11 to 7. So it wasn't like 35 to 2. But I do think that it is important to see sort of where if you really want to go to a place, the real reason to go is not necessarily to make an impression, but rather to see if it's a good fit with you. And would you like to be there? Would your significant other like to be there? Is it a culture that you would like to live in? I can tell you, when I was a fourth year, I did a rotation out in Oregon, and I loved everything about Oregon, but the program wasn't a good fit for me. So that was a good investment. What are your thoughts about, learn how are students, if they don't go and do these rotations, how do you expect them to know whether they would like to live in that place? I mean, they're gonna, if they interview by Zoom and never get to see it till they move there.
It's
true. What are your concerns there?
Yeah, I do think that, again, if there's a place that you really think that you want to be, that may be one advantage there. But if you go and after you finish your interviews, you can go and visit the city, you can talk to people, you can set up times to come and visit with some of the residents, you can see the place. So I think that is a much more valuable use of your time, because let's say that you get 15 interviews, but you've only done one away rotation. The other 14 places, you're still left in the same lurch of trying to figure out, is this a good place or not? And perhaps you had an experience on your away rotation that the Starbucks messed up your order, and now you're not sure that you could ever go there. I get that. But the other 14 places may have the same thing.
So Jeremy, one of the things I'm seeing in the chat, and I'm going to try to answer my standpoint, because I'm an East Coaster, in Pittsburgh, sort of Midwest, and now I'm more west of you. But there's some questions. Are East Coast programs harder than West Coast programs? And if you're from the East Coast, if you go to the West Coast, does it make a difference? My thought has always been that we live in a global society, and that good candidates come from everywhere, and most program directors are pretty knowledgeable about schools around the country, if not in multiple places on the planet. And so I never think that one is harder than the other, and that students or that program directors are that myopic that they don't know what good programs are anywhere in the country. What do you think? You're the DIO, you deal with program directors in all different specialties.
Yeah, I mean, certainly everyone is aware of what the different schools bring, and there's also history. You have students who've come from different schools to the programs, and you get a sense for what those students are like. I think another good question that's raised here is the impact of doing an away rotation on your application elsewhere. So, as was pointed out, if you do an away rotation at Stanford, what's your standing when you go to MGH and tell them, oh no, you really want to live in Boston? Well, why'd you travel all the way from Louisiana to California when you could have come here instead? And I think that can be a difficult situation that you get into, because it does sort of show your hand a little bit that given a very limited amount of time to do these rotations, you've selected this one program over everybody else. And so it does send a bit of a signal that maybe that's a place you're more interested in others. And for the very competitive residency programs, that can be off-putting.
Yeah, one of the questions that comes up very frequently is, we keep saying, performing well, going above. I mean, to me, what does that practically look like? It means to me that you fit in well with the team, that you step up and do, what you see the interns doing, and demonstrate that you have the critical thinking skills, the prioritization skills, you can articulate yourself, and you're enthusiastic and demonstrate ownership. I mean, those are the things I look for in residents. It's even what I look for in partners. Do you look for anything different, Jeremy?
No, I think that, those skills, and, you once gave me great advice about looking for people with real leadership experience, like Eagle Scouts and team sports and EMS and first responder. And that's been very valuable, trying to identify people that are going to just function well in a team, communicate well, and are willing to do the hard work of residency.
Yeah. What advice do you give couples about either away? So my advice to couples is always the same, is that you don't want to sacrifice your marriage for your career. And so if you're in a couples match, if your spouse or partner likes 1, 2, 3, and that same institutions are 12, 13, 14 on your list, you should both go to 7. But I've never had couples do away rotations. Do you have any experience with that?
So I am a couples match product. My wife is a pediatrician. We are still married, even with the couples match, and we're both still in practice. And we, perhaps maybe this is informing a bit of my bias here. So we did exactly what that participant was asking about. We did an away rotation together at an institution, and really tried to put on our best face, because we really wanted to go there for family reasons and everything else. And at the end of the day, that's not where we matched. And so, in the couples match, you never know who brought down whom, although I do see myself as an anchor. I think we all know that. If you've met my wife, you'd understand. She's sort of a star. But, that's certainly my personal experience. I have not had couples come to our institution, although we have matched couples. We've matched couples into our same program.
I think that one question that I think comes up, particularly from international students and also the osteopathic gang, is, can they dispel any biases that are there? And in my opinion, I think they can, but I think you really have to be prepared, be you allopathic, osteopathic, international. You have to be prepared to perform at the level of a resident. If you've done, I just know this from my osteopathic role, that some of our students do rotations in smaller non-teaching hospitals, and then it's like drinking from a fire hose. So I think it's a good experience to have that in that particular cohort of folks. And I think, will it help dispel things? It may. But more important, this isn't, I don't think you do away rotations to get yourself a job. I think you do your away rotations to see if you like it and is it good for you and what you can learn. You're paying good cash money, as Jeremy said. It is expensive. Gas is expensive. Travel is expensive. And this should be about you exploring, not, thinking that you're going to get a job. Just like, if 14 of the places, like Jeremy said, 14 of the places you interviewed at, you didn't do a rotation at, and probably the 25 that you applied to, you didn't do a rotation at either. So I think this is more about you than it is about the program picking you up.
Jeremy, I'd like to
What-
go back to a point. There was a question in the chat, and I wanted to clarify this as well. You mentioned that I think the question was directed if you went to an East Coast sub-I and you applied at a West Coast, is that going to look bad? I think, again, only if you have updated transcripts showing that you did that, or if you volunteered that. So I think we just wanted to clarify that it's not public knowledge that we know all the sub-Is that you went to, correct?
Well, if you've done it before you submit your ARAS, which you probably would if it's an audition, then it would be on your transcript. Now, it may just show up as away rotation, but it would certainly be fair game for an interviewer to, who's looking at your transcript to say, oh, you did an away rotation. Where did you go? Now, you could certainly make the argument, well, as I mentioned, I really want to do transplant surgery, and my program doesn't have a big transplant experience, so I wanted to go to whatever place and really get to see that, or something along those lines. But it could be visible depending on when your transcript is submitted.
And I think at least one of the questions I always ask applicants is, tell me about your fourth year. What have you done? Because what I want to see personally, and you fellows may think different, but I want to see that they had a rigorous year. I don't mean that they, in May we're doing, transplant ICU, but I do want to see that they've had a rigorous year and that they know what they're getting into. With 23% of, surgical residents dropping out, that's not good for anyone. So I want to make sure that they know exactly what they're getting into. And sometimes I think, if you're at a smaller institution and you go to a bigger institution, you get a little different feel for things.
Yeah, I agree with that completely. I'm always interested in what the fourth year, what the last clinical year is spent. It's such a fantastic opportunity to fill knowledge gaps, especially after your match list is in, or after your transcript is submitted to ARAS, because it's sort of done. You just need to pass the year, so you can luxuriate in all of the knowledge that you're gaining and take electives that are going to just help you, infectious disease, gastroenterology, nephrology, ICU, all these things that you're not going to get to experience in that depth again. Whereas the EKG reading elective and the home radiology elective is maybe not quite as robust.
I wanted to turn the tables a little bit, and so take your debate hats off. We've been talking about what students should do, but you as program directors, how do you see it, or what's the general gauge from program directors when you look at your own students and they go outside to do these sub-Is? How do you view them? Do you see that as something negative or neutral?
As
I see it.
Our home
Go ahead,
trainees?
Jeremy, you go first.
No, I was just clarifying. You mean our home trainees or the
Yes, they,
applicants?
you have your own trainees and they go off to the West Coast to do a sub-I, but they really want to stay with you for their general surgery training. How do you view that?
Go ahead, PJ.
So I actually, particularly when I was at East Carolina, when I was the program director, I had two different hats. physically different hats. One was yellow and said ECU surgery, and the other one was gray and said ECU School of Medicine. And so I would put on one hat and I would say, great, you should go check this stuff out. And I put on another hat physically and say, this is what I think we have to offer. I never viewed it as a negative. I think it's incumbent upon us as faculty to get the students where they want to go, not so much where we would like them to go, number one. And number two, I think it's good to have a broad experience. I've never viewed a student negatively who's applied to us, but they said they wanted to check out some different stuff. That means, to me at least, they're making a well-informed, wise decision.
Yeah, I mean, we also we don't try to match our top group, meaning if I know that a medical student desperately wants to live in California and is doing an away rotation because that's where they want to be, and when it comes time to match them, we're going to rank them based on how well we feel like they would fit with the program. But I do give them exactly the advice that I put forth here. I feel strongly about what I said at the beginning, and that's exactly what I tell them. Basically, build your community here, do an away if there is somewhere that you really need to be. Your partner's already at Hopkins or Stanford or whatever, and you need to go and show them that you can excel there, then absolutely do it. But otherwise, stay here, take advantage of the resources we have. But no, it does not impact how we rank them.
We get to some of these other questions. So another one here is that, are there other ways of, quote, auditioning other than just going there?
So
ways.
some places, and I don't know if you guys do this, Jeremy, some places offer, particularly now in the era of Zoom, to come and do, a night on call. We used to do that pre-Zoom for some folks. We would usually do that after the interview so they would get to see things. I think that's one way to maybe, your foot's, it's not really an audition. Again, it's really for you to see sort of what it's like. I've always done that after the interview though, not before. And I think sometimes too, I'd say, like we have the medical student program coming up at the American College of Surgeons. And yes, you can be introduced to some residency directors, but they're not selecting you then and there, but it would give you maybe a feel for, what the program directors like. A lot of times they have residents that are there. So I would recommend that program to you guys. Not so much for, hey, this is going to get me a residency, but I might be able to learn a lot of stuff about different programs.
Yeah, I agree. Now, I do think that the Zoom age, if you want to call it that, or this virtual interviewing, has really opened up a lot of opportunities for programs to showcase their culture. Social media, websites, people are really doing a lot of interesting stuff. The pre-interview meeting, which will usually be a Zoom session of some kind, I think is also a great way to learn the culture. Just to highlight what's happening, at our program, the Zoom night is a mix of some rooms you're there to talk to the residents and ask questions. And in some rooms, you're just playing video games with the residents and chatting with them and having fun. So you can sort of get a feel for what it's like to talk to them. And I can tell you, people at the end of that, when we talk to them, they say, that's where I really got the sense of what this place was like. And the residents too get a sense for what the trainees are like. But I think you can get a sense of the culture, at least through these other avenues. And you can put yourself forward just through the interview process by really engaging and following up with the staff.
The one thing I do worry about though with all of that, Jeremy, is it reminds me a little bit of a piece of advice I got when I was looking at colleges, that they're going to take the prettiest, couple, put them under the prettiest tree in front of the prettiest building. And I went to college in the Bronx, And so, not sure that's, I just worry about that. I agree. It can sometimes show you a great deal. Sometimes it doesn't.
Well, I
Um,
agree. I mean, you are seeing the prettiest tree, but if the prettiest tree isn't that great, then you've got a good sense that it's only going to go downhill from there. And
That's
I
true.
mean,
That is
honestly,
true.
if the website is off-putting, I mean, that's the best foot forward.
Yep, exactly. So, somebody has asked in the chat, is it permissible to shadow? Um, I would not recommend shadowing as a third or fourth year medical student. I think shadowing as an opportunity to, do some career exploration in the first 2 years, I think makes sense. Shadowing to go just look around, I don't think that would really work as well. At least that's my thought. I don't know. Do you think differently, Jeremy? Or
No, I agree completely. And, we often get people that aren't eligible to do an away rotation. They'll come and do an observership, and it's really just not very valuable because you can't demonstrate your ability in the same way that you can on an actual rotation.
right now, I'm assuming this has come up a couple of times. International rotations. I think international rotations are very different than, unless you're planning on trying to do, your residency, in Australia or somewhere. I would say international rotations are substantively different than audition or away rotation stateside.
Yeah, I would save that for after the ARAS is done. Use that for your own professional and personal development rather than as a way to enhance your application.
Yeah.
What about other ways of getting in, like research, even though you can do sort of virtual research these days if you link up with somebody? Any thoughts about other?
I worry about that. I worry about that, and I've seen that work. I've even seen that work when I was at the University of Nebraska very, very effectively. And so yes, it does work. But again, you're working, research and clinical duties are very, very different. And so I think it is a path forward, but it's one I take with caution because I think they're just set up in such different manners and focusing on such different things.
Yeah, I think that should be done a little bit earlier. So,
Yeah.
people who think about, well, maybe I can try to do some virtual research to better my CV before application. It's not going to work very well.
Yeah, I think the best time to probably, and this is just PJ's opinion, to bolster your CV is the year between the summer between your first and second year. That's the time you can do it, because by the time you get to the end of your second year, it's too late and you're going to be tight on time until match day, and then it's way too late. So
yeah, and I'll bring it back to a reason to stay home. My opinion is that there is a golden letter, and the golden letter is the letter writer who has worked with you clinically, who has done research with you, and who knows you personally. That letter is the most valuable to any program director. And that's going to be almost impossible to get from anywhere but your home institution. So if you
I would absolutely agree with that, Jeremy. I've seen, particularly in the subspecialties, and I've seen this in the osteopathic world, that students think I'm going to go and get I'm going to do an away rotation and I'm going to get that letter. I find that few and far between, because those faculty members that you're rotating with are primarily dedicated to their own students. And they may write you a good letter, but I think chances are slim on that. You're better off staying out. Now, some people can't, and I understand that. But I do think, you want letters from people who really know you, who are invested in you, for sure.
Wait, You almost said something there. Can you just clarify? You almost said you're better off staying home. I thought that's what I almost heard you say.
I think you're better getting your letters from home.
Oh, okay.
It must be that Pittsburgh smog has
Boy,
gotten in
it's
your
just, it's
ears.
getting close. It's getting close. We'll
As
go. We have
yeah,
a few
yeah.
minutes left.
But no, I mean, I think that I think the reason, and I know we're starting to come up on time here. I really still believe, and I know you do too, Jeremy, because you're a modern man who's good looking and who my wife likes. Who it's about you. And if you want to go check and see if you like living there and exploring something different or something you don't have an option to at your own place, then that's a wonderful opportunity. But you should go for you. You shouldn't go for them to check you out. At least that's my own opinion. And I don't get checked out very often because there's not much need to check out a big fat guy with an ill temper.
I'd like to get back to the shifting frames theory we talked about earlier, is not to try to match at a general surgery program in order to get into the fellowship. And there's a question out there, should we shift the frame earlier?
Med schools.
Should you try to get to a med school so that you can get into that particular training program?
I don't think so. I mean, I think you go to the medical school that aligns with your interests. It's going to give you excellent clinical training in the areas that you are interested in. So much changes. When I went to medical school, there was no doubt in my mind I was going to be an ER doctor. I had been a paramedic. I had done EMS. I've been working in that world for my whole life up till that time. That's why I went to medical school. And I sit before you, a humble colorectal surgeon, having had many twists and turns in the road. And that happens to almost everybody. I think it's a small handful of people, perhaps the cardiothoracic surgeons, as babes are touched in the crib by the angels and it's decided that that's where you'll be. But everyone else, I think we sort of go through an evolution and a process. So to make that decision at the outset, I think is a mistake.
I would not only echo that, I went to med school to do OBGYN, and I hated delivering babies when I actually got the chance to do it, which it just wasn't as much fun as I thought it would be, and changed course. And actually, I think one thing that students sometimes forget is that, you can change course even after you've matched. I actually was a pathologist before I was a surgeon. And it's okay. The person who works at Chick-fil-A doesn't have a crisis of conscience when they decide to change their mind and go work at Walmart. And so it's okay if, check it out. And if you get started in it, great. And if it's not a fit for you, then you change to something else. It's an okay thing to do. But I don't think anybody coming out of college knows exactly what they want to do until they sort of experience it more. But
Yeah,
Dr. Yang may have been different.
No, about the same. I wanted to do family practice. I wanted to stay in Richmond and be like my family doctor because I really adored him, growing up. And now I'm just a lowly thoracic surgeon, so I didn't achieve that.
Yeah, but you're at the John Hopkins, sort of like Ohio State.
I'll also say I think probably my number one advice to all the med students is actually to go elsewhere. It's good to see the world. I think you spend 4, 5, 6 years at the same place and you get that comfort level. But I think it's much better to go out and see the world. And yes, you're gonna gamble a little bit going out and doing sub-Is. I'm going to be more on the PJ side. I think it's best to go see the world, see how other people do it. You have your mentors at your medical school, and I think it's best to just keep growing more mentors. And so even with the students that I love, it's not that I don't want them to stay here. I think it's best, since you're young and mobile and you're just starting out with families, is to go out and see the world. And I keep telling people to do that. After residency, go someplace else to do fellowship, and then don't stay at the same place as fellowship unless it's a great job. But to go,
I've done the same thing, Steve. I've gotten crossways with at least two deans and one chairman in my career for saying exactly that. I think actually, as if I put on the dean hat for a moment, the best thing we can do is take our best medical students and send them out into the world to other places, and have them carry our flag and learn something new. And then if they want to come back, great. But go have an adventure, go have fun and see something, different, learn different skills, broaden your horizons a little bit. Now, I know Jeremy won't agree with this because I don't know. I always thought Cleveland was a suburb of Pittsburgh, but he might think differently. Maybe he didn't go that far.
well,
Yeah.
Anyways, a couple more questions here. I think, someone asked about how do you stand out? We did a webinar last time, so that's on our website. And come to the Clinical Congress meeting, the Med Student Program that Cassie put in the chat.
Jeremy, can you discuss the golden letter? Because that's up here too. And I've always thought the letter should come from someone in the specialty that you want to match into, unless they know you remarkably well. If you did, 3 years of public health research in the Department of Family Medicine, and you decided to go do that, like a letter from somebody like that may be valuable, but getting a random letter from another specialty, not as helpful. What do you consider the golden letter?
Yeah, I agree. I mean, I think it's going to be different in the different subspecialties. In general surgery, I think any surgical specialty counts. So if you've done a bunch of ENT research and you've done some time working with an ENT surgeon and they write you a great letter and you're applying to general surgery, I think that's great. It does raise a little bit of a red flag for some programs. Are you dual applying? Is general surgery a backup? And that can be problematic in some programs. Having said that, the same type of letter from a family practitioner when you're applying in general surgery is not going to carry much weight. And most program directors are really looking for some type of surgical letter. What do you think, PJ? How do you treat those letters?
I agree. I think if it's somebody who knows you well and can comment on you well, but if I get a letter from outside the specialty, unless it's unique, I view it with suspicion.
You mean if I wrote the letter, you would see that as suspicious?
No, because I know you would never write a letter for somebody of the quality, character, or intellectual stature as myself. I know you would rather write a good one for my worthy opponent here, Jeremy.
Yeah. So to finish that, again, I think the golden letter should be somebody of very high rank. The other specialists can help, especially if they've been teaching medical students for quite a long time. So I think our time is up. I think we want to have, before all the med students log off, please do go to the website and give us your feedback about this. Give us thumbs up, tell us who won, whether it's Dr. Schnartz or Dr. Lippman. Please go to the website. Reserve the time in San Diego. It'll be a great time for the medical student program. We haven't met for 3 years, and so we expect a lot of you med students out there. So again, I'd like to thank the staff again, particularly Cassie and Kim, for all of their expertise in organizing this, and to the rest of the ACS staff, and particularly the Dr. Schnartz and Dr. Lippman for their time and expertise in doing this debate. So everybody have a great evening and have a wonderful summer.